My name is Tim Long, I'm the CEO and founder of New Life Medical Centers, and today I'm going to talk to you about why we use amniotic allograft products above all. And we're going to cover some of the other products or services that are out there and why we don't use those anymore, although a lot of clinics still do. And we're going to cover some details about what's in the amniotic allograft products and how it's collected. So just kind of bear with me. But the reason we use it above and beyond every other thing is that it works. It gives a consistent result. We know what to expect when we use it with a patient. And it's not a shot in the dark like a lot of other things are. So I'm sure you are just like me. I don't want to have somebody overpromise something and underdeliver. I would rather someone underpromise and overdeliver. Because in society today, everything, they're promise, but they don't really deliver. But this product delivers, it delivers consistently. And you'll understand why once we get into it in just a minute. But that's the main reason we use it, is it works, it's effective, it's consistent, and we know what kind of result the patient can get. And just so you know, we're a small local clinic in the West Tennessee area. We're not as well known as others, but we always stay on the cutting edge. We're always pushing that edge. That's mainly what I do at this point. I do research, and I take that research and bring it to our providers and doctors and put together protocols. And just so you know, when PRP, platelet-rich plasma, first came out about a decade ago, we were one of the first 10 in the country to have and offer the first FDA-approved system for collecting platelet-rich plasma, PRP. First 10 in the country. And there were only 10 doctors, clinics there for the very first meeting. We're the first 10 to sign up. So we're going to always stay on the cutting edge of anything that's available so we can help our patients. So let's kind of get right into it. Now, in other videos I've discussed where we don't use adult stem cells or platelet-rich plasma really anymore. And here's why we don't. There's 3 different ways you can collect stem cells from adults. That is through your blood, PRP, through adipose tissue, which is basically liposuction, and they'll take your fat and they'll spit it down and collect the platelets and the stem cells from that. And then bone marrow, same thing, where they'll usually go into the back of your hip and they'll drill into the bone, they'll collect the bone marrow, and then they'll spin it down. And then again, you get the platelets and the stem cells, and all of those procedures, they'll collect it, spin it down, and then inject it into whatever issue you're having. Well, here's the negative things about that and why we don't use them anymore. The primary reason we don't use it is because they're just not as effective and it's a shot in the dark. And here's why. And first of all, everything you collect, whether it's platelets or stem cells, are the same age as you are. That's why we age. We just don't regenerate like we used to. We don't recover like we used to. And I'm sure, especially if you're even 30s, much less 50s and 60s, you just don't recover like you did when you were in your 20s or when you were a teenager. So, well, all your cells in your body are the same age as you are, they're the same way. That's why you don't recover, and that's why you age. And just to give you some, and not only does it say it in the research, when we went through the training, they told us that the older the patient is, this is when we were doing the PRP and stem cells, when older the patient is, the less product you're going to be able to net from it. And we saw that firsthand in the clinic. Now, we would collect 60 mils of the patient's material, whether it's adipose or blood, whatever it was, and we would spin it down, and with a 30-year-old we would end up about 10 mils, which is what was expected. Well, with a 50-year-old we would end up, and this was a healthy 50-year-old, we would end up with about 7 mils, and with a approximately 60-something-year-old we ended up with about 5 mils. So the older the patient was, the less material that we would net to inject and treat that patient with. So not only do you have the stem cells and the platelets are the same age as you are, they're just not as effective as they used to be, we also get less of it. Secondly, another big issue is in the research is in adult stem cells, the stem cells are for specific tissues. So when you would collect those stem cells, you had no idea what stem cells you were collecting and what tissues they were for. There's some that are very specific for like skin, there's some for heart, there's some for different organs and bones. They're very specific to what that cell's willing to turn into to heal. So it's like a shot in the dark, you just don't know. And those treatments would still get, you would still get some benefit from them. You would get, less, it would help with like inflammation and get rid of, it would start to heal it just a little bit, micro tears, things like that. But as far as actually going in and regrowing tissue that was either missing or had been greatly injured, it wasn't very effective for that. And additionally, in addition to all of those, but those are the main reasons we didn't use it, because they just couldn't get the result that we were looking for. But the other reasons is it's very invasive. I mean, if you're doing just a simple blood draw, that's simple. But if you're doing adipose tissue, you're doing liposuction. Even in the bone marrow, they're drilling into your hip bone to pull it out. So it's much more invasive, and you have a recovery time, obviously, after that. And you just weren't getting the results. You're going through all that trouble and not getting the best results you could possibly get. In addition, the cost is very expensive because it's not covered by insurance. In the local market, West Tennessee market, we called around to see what the prices were, and for something as low as like a PRP, which is platelet-rich plasma, it was $4,000, all the way up to a bone marrow, which was $17,000, and we saw prices everything in between. So anywhere from $4,000 to $17,000 for a shot in the dark is the way we felt about it. So we came across the amniotic allograft products years ago and did the research, and then actually tested them in patients and tested them here. And that's why we switched, is because that method of collecting stem cells from adults, it wasn't consistent. You didn't know exactly what you're going to get. It's very invasive. It costs a lot of money. Where with the amniotic allograft products, we knew what kind of result we were going to get, and I'm going to explain here why. So what is an amniotic allograft product? It's a product that's collected from the amniotic material left over after cesarean birth. It's completely ethical. The way it's collected is the lab we work with, that we source our material from, is the only FDA-approved lab in the country. They have relationships with hospitals around the country, and what happens is when a mom and a doctor determine in advance they're going to have a C-section, and they schedule it, the hospital will approach them and ask them if they want to donate the material that's left over, which is the placenta, the umbilical cord, the cord blood, and the amniotic fluid. Everything's left over after the birth, and then it's donated to the lab, and then the lab will take that and turn it into 40 to 60 products that works for everything from burn victims, cancer victims, even building scaffolding for like holes in the heart. And the product that we focus on is this product's designed for soft tissue repair, like cartilage, ligament, tendon, muscle, skin, even some bone. And that's the products that we focus on. But they will then donate, and they turn it and process it. So they will, when the mother goes in to, first of all, they test the mother, but when the mother goes in for the section, the lab is there to collect it, and they take it back and turn it into the products. Now, that's how it's collected. And again, the research, there's over 900 studies on it at the moment, and there's constant innovations coming. And we're always going to stay on the cutting edge of that. Now, why do we use that product? One is it gets a result, and it gets a consistent result, and we know what to expect, so it works. And let me explain why it works. When they collect those materials, especially the stuff that we're using, the amniotic allograft products that we're using, it has, it's primed. Well, first of all, the material is only 2 to 4 days old. Obviously, it's come from after a new birth. So that material, everything in that amniotic allograft products, all those amniotic products, were primed to help that baby grow from 2 cells, an embryo, all the way to a human baby. To grow healthy, quickly, and as fast as possible. So everything that baby needed was right there in those materials. So you can't get a better cell or better material to work with to start with. It's something that's only 2 to 4 days old. Second, they are immunoprivileged, which means your body's not going to reject them, which means any human can accept that material, and they don't have to worry about any type of rejection. They've injected over 120,000 patients, and they've never had an issue with it. So it's safe to inject into other humans, so you don't have to worry about that. But what's the main reason we use it? Why does it work, and why is it effective? Well, inside those materials, you're going to find growth proteins, cytokines, exosomes, and you're going to find mesenchymal cells. Now, mesenchymal cells that all those support the mesenchymal cells. The mesenchymal cells are what they are. They're what they call multipotent stem cells. Now, what that means is that the cell can turn into many different types of tissues. So, for example, you've got bone. It can turn into a bone cell, which is osteoblast. It can turn into cartilage, which is chondrocytes. You can turn into muscle cells, which is myocytes. So it can turn into any type of cell. Now, that type of cell, a multipotent cell, has to have a tissue there for it to activate it. So let's say, for example, you have a bone on bone. If you have a cartilage that's been removed or torn, you have to have at least 40% of that tissue remaining for that mesenchymal cell to go in and start to grow and reestablish and build the scaffolding and stabilize the need to regrow that tissue. So, or like a tendon or ligament tear, you have to have at least 40% of the connective tissue still there. So it could be 6% compromised, but you have to have at least 40% there, go in to heal it. So the multipotent cells that we can get here in the US, you have to have tissue there for it to attach to and to heal. Now, outside the US, there's cells that you can use that are pluripotent, which means they can actually go and turn into any type of organ or tissue that's not even there. So that's great, and we don't have that available in the US. We have relationships outside the US that if it's something you need, we could send you there. We have relationships with doctors out of Atlanta who have clinics in Costa Rica and Colombia that we could send you there for that if that's something you needed, really needed. But in the US, the amniotic allograft products are the best on the market at this time. And if you have a simple injury, like a knee, elbow, shoulder, hip, whatever it is, this product is going to work perfectly for you. But you have to have tissue there for it to work. So if you're a patient who has bone on bone and has no tissue, it'll help with inflammation, it'll help stabilize all the other tissues around it, but it's not going to regrow that cartilage. So you have to have at least 40% of the cartilage there for it to regrow it. Like in my personal testimony, I have 50%, and I was able to regrow that. Now, it doesn't mean that's going to happen for you. This is not medical advice. This is for educational purposes only, and you may not get the same results. But that's why we use it, because those mesenchymal cells are so potent. They can go in and actually turn and regrow. They can turn into any cell that's needed and regrow that tissue. So they work, it's effective, it's prime, ready to grow, it's safe for you to use, and there's virtually there's no downtime, and it's not invasive whatsoever. Simple, it's no more difficult than getting a cortisone shot in the knee. It's very simple, very easy. To kind of give you an example what to expect, you'll come into the clinic, you'll check in, you'll meet with the provider, they will pull out your product out of the freezer, they will thaw it, they will pull up into the needle, and then they will inject it. The injection itself literally takes 5 minutes, and as soon as within 10 or 15 minutes, they will release you. So from the time you walk in to the time you walk out, it's about 45 minutes. There's virtually no pain to it. Everybody's a little bit different. You may experience a little more pain, but most people it's about a 2. But you're able to get up and go right back to work. Or in my case, in my personal testimony, I got up, got my shot, went straight to the gym. So there's virtually no downtime, and the cost is going to be less than those other stem cell products out there. For example, it'll cost anywhere from $2,000 up to $6,000, $5,800, depending on if you're doing like an elbow or knee or both knees. It just kind of depends on what you're looking to do. And it's still expensive, and insurance doesn't cover it. But if you want the best product and the best chance to get your life back and to get rid of the pain and to stabilize that joint, that's the product for you. Also, we know it's very expensive, so we work with you. We'll do financing. With credit scores as low as 580. The payment can be as low as like $120. It just kind of depends on what you're looking for, what you're needing. But we do everything we can to make it affordable and make it easier for you to get the treatment. So that is a kind of a brief summary of why we use amniotic allograft products, because we believe there's not a better product in the United States at this time for helping patients with soft tissue injuries that are pretty major and severe. So if you have any questions, feel free to give us a call, contact us, direct message us, email us, or call us. We'll be glad to sit down with you and explain it in more detail. Hopefully this has been an entertaining video for you. And that is a summary of why we now use amniotic allograft product versus the adult stem cell method. So feel free to give us a call. We look forward to meeting you.